Welcome, my name is Peter Strong and I provide online therapy via Skype for the treatment of anxiety and depression, and particularly to provide online help for people suffering from agoraphobia. So if you're looking for online psychotherapy to help you overcome your agoraphobia, then I invite you to look at my website and also look at some of the other videos on my website and learn more about the online mindfulness therapy service that I provide for working with agoraphobia and other anxiety disorders. So for the agoraphobic, it's really important that you have access to online therapy because it's so difficult to travel to see a therapist in person, because most agoraphobics are homebound. They're not able to leave the security of their own home. And it's really very difficult to get a therapist to come and visit you. So online therapy is often the best option. Now, as long as you use Skype so that you can see each other, then there's really no difference in effectiveness between online therapy and seeing a therapist in person. You don't need to be in the same room as your therapist to benefit from psychotherapy, but you do need to see each other so that there is effective communication. So I see people suffering from agoraphobia throughout the United States, and I also work with people in Western Europe and the UK, and as far away as Australia. All you need for online therapy is a good internet connection and a quiet place to conduct your therapy sessions. So in the mindfulness therapy approach to agoraphobia, we do it in a very organized, very strategic way, using a technique that I developed a few years ago now, which I call mindfulness-based exposure therapy. Exposure therapy is obviously an important part of your recovery process. You have to really confront your anxiety if you want to change it. But the way that you go about that is what's important. So just throwing yourself into anxiety-producing situations, what we call exposure challenges, is not an effective approach to exposure therapy. What you need to do is to do a great deal of rehearsal and training before you do your exposure challenge. So this is where you would play through the scene, you would imagine it in your mind. Whatever that might be, it could be walking into a shop or a supermarket. It could be as simple as walking to the end of your street. These are all examples of exposure challenges. The important thing is to prepare before you do your exposure challenge. So we play it through in the mind. We watch for the anxiety reactions that may get triggered. And then we start to work with those anxiety reactions using mindfulness. So the way that mindfulness works is, first of all, it starts to help you disentangle yourself from the anxiety. The biggest problem is what we call reactive identification, which is where we just become totally identified with the anxiety. We simply become the anxiety. We contract into that emotional reaction. So the first part of mindfulness training before you do your exposure challenge is learning how to see the anxiety but not become identified with it. So we develop some space. In this way, you start to train yourself out of that blind reactive habit of identification. So that's really important, because if you identify with your anxiety, it simply feeds it. But when you stop identifying with the anxiety, then that takes away the fuel that feeds that underlying anxiety. So you can essentially neutralize the anxiety reaction just by learning how to sit with it objectively with mindfulness, to see it as an object. So that's a very important part of training. We develop it even further by bringing in the element of compassion. This is really important because another major factor that causes our anxiety is the lack of connection or relationship with that anxiety. It becomes an isolated part of the psyche. It becomes suppressed and often essentially abandoned. And under those conditions, where there's no conscious relationship with it, it cannot heal. So it continues to generate anxiety every time it gets triggered. So this overcoming this problem of a reactive abandonment, as I sometimes call it, we have to again cultivate mindfulness of that emotion. We learn to sit with the anxiety, very much in the same way that you would sit with a child that was afraid. You learn to sit with the emotion, because that emotion is where the fear is. It's not you who are afraid, it's the emotion that is afraid. So you learn to develop not only a conscious relationship with it, but also a compassionate relationship with that anxiety emotion. You see it as an object, and you relate to it with compassion, and that is a very powerful healing force. And this now builds a very strong internal psychological relationship between your higher self, that's not afraid, and the emotion of anxiety that is afraid. So this overcomes reactive abandonment. And that, again, promotes healing. That is essentially what the anxiety must have in order to neutralize itself, in order to let go of that anxiety. The same analogy as with a child. A child needs to feel the direct, conscious presence of its parent, that which is not afraid, in order for the child to release and neutralize its anxiety. So developing these internal relationships is vitally important for healing. And not just anxiety, but many other kinds of emotional reactions as well. So we build that during mindfulness therapy. So this is the process that we engage in before we do the exposure challenge. We help heal that anxiety reaction. We help it heal itself until we can experience the decrease in intensity of the anxiety. We can see it release itself, resolve itself. So we play through the scene in our mind, and we work with the anxiety using mindfulness until we can imagine doing that exposure challenge without any anxiety at all. Then is the time to do the challenge, and there you're putting that training into effect. You're now building the direct experience of that change in the mind. So anxiety is best described as a habit, and all habits can be changed when you work with them consciously, in detail, and with that quality of compassion or friendliness that will increase the conscious relationship with the emotion. So you help it heal. That's one of the main components of mindfulness therapy. We heal the emotional reaction. Then it's possible to do the challenge. And so we repeat this process over and over again until we can actually do the challenge without any anxiety at all. Then you move on to another challenge on your list of exposure challenges, and you prepare for that in the same way. So this is a brief introduction to mindfulness-based exposure therapy for agoraphobia. It's very effective, and it's all done online via Skype. So if you'd like to get help overcoming your agoraphobia, then please reach out to me, and we can schedule a Skype therapy session so you can begin to learn how to do this effectively. So please contact me if you'd like help overcoming agoraphobia. Thank you.